The brain, a pulpy mass of cells and fibers.
Brain is, of course, is an enormously complex structure.
Made of proteins, fat.
The human brain is 3.5 pounds of tissue that makes us the very essence of who we are. It's made up of 100 billion brain cells, which has over 100 trillion connections. That's more computing power than any known supercomputer that we could ever imagine. Our ability to create, to understand how the universe around us works, to discover new science, from molecular mechanisms of the workings of cells to how to build incredible cities and to really explore the world beyond us.
Oh, it's beautiful, Mike. It really is.
Oh, geez, that's great. Is the lighting halfway decent?
Yes, indeed. They've got the flag.
That is all done by this 3.5 pounds. Cedars-Sinai is really a very special institution. We treat more disorders of the human brain than almost any other medical center. Brain cancer to stroke to spine disorders. We are one of the largest caregivers in the West.
Thank you.
Okay, so we'll see you. We've never had a time where all of these things have really come together, where complex things that we're trying to treat without much room for toxicity, for the first time we actually have a shot. When I first moved to Cedars about 2 decades ago, we came up with the concept of whether or not we could teach the immune system how to identify the cancer, how to attack it and potentially eradicate it without the need to do radiation therapy and chemotherapy. And we were really the first in the world to develop therapeutic vaccines for brain cancer. This cancer that has a median survival from time of diagnosis to death of about 1.5 years, with our latest generation of the vaccine, we now have patients that are living past 10 years that have received the vaccine for this cancer. We've now moved this vaccine into 120 different medical centers around the world in a phase 3 trial, and it's the type of things that we're doing that I think can really be truly transformative in terms of our ability to impact brain disorders. In the last 114 years, life expectancy has increased 40 years. But what we know is that our bodies are designed to really outlast our brains. By the time one reaches 65 or older, 1 in 8 of the individuals in that population will have Alzheimer's or some type of dementia. What we now know is that Alzheimer's disease has actually started 20 years before the patient has developed symptoms of Alzheimer's disease. We ask ourselves, how can we do better? And it turns out that the back of the eye is an extension of the brain. The human retina is brain tissue that we can see when we look through the eye. The hallmark of Alzheimer's disease that occurs in the very earliest phase, these misfolded proteins that form in plaques that are called amyloid plaques. We've developed a way of looking through the eye non-invasively with about a 10-minute test to be able to detect very precisely these amyloid plaques in the back of the retina. This is allowing us to essentially see the very earliest stage of this disease, and we can actually follow how the disease is increasing and progressing 20 years before the patient may develop symptoms. When you go in to operate on a brain tumor, that brain tumor can look exactly like normal brain tissue at surgery. We have a very difficult time visually trying to see what's tumor and what's normal. And in the brain, it's high real estate areas. So you have areas that control language, control memory, control vision, control motor movement, so we cannot really do these wide resections. And one of the things that we are pioneering at Cedars-Sinai is taking the venom of scorpions, which is called chlorotoxin, and it has a very unique property in that it only binds to the cancer cell. We tagged it with a fluorescent dye so that when we inject it in patients, it goes right to the cancer cell and make those cells fluoresce during surgery. And we're using techniques like this to be able to more precisely do surgeries that are less risky for our patients and allows us greater ability to remove even those infiltrative, isolated tumor cells that are so difficult to find. I'm Dr. Keith Black, Chairman, Department of Neurosurgery at Cedars-Sinai Medical Center, Los Angeles. My own view of what really makes a good brain surgeon is that the surgeon, number one, must consider the brain to be sacred territory and to consider themselves to be very much like a thief in the night. What we essentially want to do is to sneak into the brain, get the tumor or get the vascular malformation and get out without ever touching the brain, without the brain ever realizing that we've been there. It's not good enough for us just to be good surgeons, to be able to treat the patients with what we know now. One of the things that we want to do is to move beyond what we know now and to ultimately provide cures for a whole variety of disorders that affect the human brain. We've looked at a number of innovative ways to try to find a cure, for example, for brain cancer. You know, our patients come with disorders that affect their brain, their spinal cord. It's some of the most challenging health circumstances that one could ever imagine. And we want to give them a sense of calmness. We want to give them a sense of relaxation and a sense of tranquility, as well as hope. I'm Dr. Keith Black, Chairman of the Department of Neurosurgery at Cedars-Sinai. 15 years ago, my mother developed Alzheimer's disease, and she had a 10-year course and ultimately passed away from Alzheimer's. There are currently 5 million people with a diagnosis in the United States of Alzheimer's disease, and that number is going to go to 20 or 30 million by the year 2050.